Hello, everyone. My name is Carissa Brewster. I'm the writer for Whitman Partners, and we are doing our 2023 BIPOC Perioperative Leaders to Know Recognition Awards. And today we have Lisette Meszaros, who is the Clinical Effectiveness Consultant for Sutter Health PAMP Surgery Centers. Welcome, Lisette.
Hello, thank you. Thank you for having me. Well, when I was 8, my grandma was diagnosed with breast cancer. I can still remember like how sick she would get after her cancer treatments, and she went through intermittent periods where she'd go into remission and then it would come back. And she was a fighter. She fought for 28 years. In 2017, she passed away from metastatic breast cancer. My grandma was like my favorite person in the whole world, and I think I was hers too. But I volunteered with a youth at risk outreach program when I was 15, and it was like we would get formal training about like STDs, HIV/AIDS prevention, gang awareness, teenage pregnancy, and we would hand out safe sex kits and go speak at colleges and boxing clubs and juvenile halls. And we worked with a lot of gang affiliated youth and predominantly like Black and Latino lower income neighborhoods, and volunteered at HIV/AIDS programs and did a lot of that kind of thing, in my teenage years. And then started off as a medical assistant. At 20, I worked at Stanford Linear. Yeah, so at 20, I was at the Stanford Linear Accelerator in Menlo Park. We did mostly like preliminary annual surveillance exams. And so that consisted of like lab draws and vision tests and pulmonary function tests, EK, hearing tests, that kind of stuff. Treadmills, ergonomic evaluations. We had to be part of FEMA, so we were a little bit of everything. And then 2 years later, I took a job at NASA, the NASA Ames Research Center. I was there for 10 years, also occupational health care. So I was responsible for making sure that there's 3,600 employees, so civil servants and contractors. We had to make sure that they met like the federal and OSHA compliance for their medical surveillance program. So if they were an animal handler or worked with confined spaces, or they did like diving for research, or depending on what job they had, we had to clear them. So we had flight physicals, or they all had really interesting positions, and it was really cool talking to all those patients and finding out what they did. I would have probably still been there and never left, but I went to nursing school while I was at NASA. And so that's the only reason I left, because I needed to, learn more and, go somewhere else so I can learn more. And I did. That's how I got to Sutter.
Yeah. That's like amazing that you like worked at NASA. It sounded like it was a really interesting job.
Yeah, it was. So I started with Sutter just so I can get more experience in a different healthcare field. I started off in sports medicine, and I worked with Dr. Frank Chen. He's like an incredible orthopedic surgeon. And so working with him gave me exposure to like the surgery side of things. He was the Warriors team doctor. So that was pretty cool too. And so anyway, I was fascinated with the surgery side of things. And then I transferred to the ambulatory surgery center. So that's how I got into the surgery centers. And then from then I was working on the floor. I worked for Surgery Center Mountain View and Surgery Center San Carlos as a pre-op admissions nurse. So we cared for like a high number of patients doing their admissions, starting their IVs, prepping them for surgery, asking them a million questions while getting interrupted, all day long. Also prepping for like Triple HC accreditation and audits and all that kind of thing. So let's see. Years later, I probably would have made what some would consider like a really good career move, but unfortunately, I made this decision during 1 week before the pandemic hit to go into risk management, right? So I joined the risk management team for Sutter, which is like part of the Office of the General Counsel. So it's like way up there. Um, and I'm talking, this is direct oversight of 3 divisions, 555 clinics, a 241 bed hospital, 6 surgery centers, 2 fertility clinics, like all of this craziness. And then a week later, COVID hits. It was crazy because we're on all these high level calls. Nobody knows what's going on. And I don't mean like my company, I mean nobody in the whole world, like the county, the state, nobody. And we're going from call to call to call. And so I'm new to the position, and you want me to tell managers that we don't know what we're doing? Like, really?
Yeah, that's a tough position to be in.
Yeah. And then on top of that, I would turn the news on, and the news, I'm like crying watching the news. We had, supply shortage. We didn't have no respirators. We have the George Floyd and Breonna Turner and the Ahmaud Arbery stuff going on. We got Trump in office. I mean, it was the most depressing, horrible time for me. It was bad. It was really bad. So
I can imagine.
That was that. And once things settled down, I stepped down. And so now I'm one of 2 quality nurses for the ambulatory surgery centers. And I love it. I love it. Yeah, I think numerous times, really. When I first joined the pre-op admissions team, I worked with a nurse that was assigned to a certain OR room. She brought the next patient in the room, and then immediately she went on break. She didn't finish admitting her patient. She got back from her break and sat down at the PACU desk, started reading the newspaper. And meanwhile, I had finished admitting my patient, and I asked her if she needed help with getting her patient ready. And her response was, "Oh, good. I was hoping somebody else would take it. And good luck with that one," and her attitude. You know how they are. And then so I turned around and I'm like, "They." And in my head, I'm thinking, like the you people, like they, So, but she didn't like flinch or nothing. She was just very comfortable with what she said and just continued reading her paper. So I admitted the patient. She was like a very nice patient. She was really funny. She just cracked me up the whole time. We just talked about everything. Nice lady, like middle-aged Black lady. Obviously, I think this nurse had some preconceived bias, clearly. Your question was, how was it handled? I mean, I just took her patient. It made me standoffish towards her after that, because I figured if you have that kind of feeling towards somebody after 1 minute of an encounter with this person who you don't even know, that just says a whole lot about you. I can think of another time at NASA, while I was working at NASA, totally different scenario, but it sticks because it was how this person talked down to me in his tone. I was at the cafeteria ordering my breakfast, and he asked me, he told me to go clean a table off. And it's like, I don't even work here. Like, I have on scrubs. I work across the street because the health unit was right across the street from the cafeteria. And nobody, like the cafeteria people, they don't even clean the tables off. Like, you're supposed to take your tray and put it next to the garbage can, and there's a sign that tells you.
Yeah.
He's telling me to, like, oh, I need you to go clean this table off. And
wow.
Yeah. I still remember that. So That was not okay.
So did you like just kind of look at him and just kind of went your own way, or like what?
I remember telling him that he can clean off his own table.
I mean, and it probably just went over his head too, like, oh well, oh, and then like he
Right.
cleaned off the table. Wow, yeah, those little tiny things, people like to minimize microaggressions, but stuff like that, it just kind of like stops you, like you have to process it. That takes energy.
Yeah. Embracing other people's backgrounds and cultures, and taking into consideration their perspectives, and respecting other people's opinions. Sometimes like we've had patients who only speak a certain language, or for example, I speak Spanish. So I've had a patient who doesn't speak any English and they come in really scared. And sometimes they'll just nod their head and nod and agree, and they won't answer the questions correctly, or they'll forget to tell the doctor something that's very important. If like another nurse will come get me to translate, you can just see that big sigh of relief, and like their smile, they light up. That smile lights up the whole room, because it's like they're so they've been put at ease. And I think you can't get that with the translator phone. And I think if you have a certain demographics of people, I think it would be helpful for management to hire more people from different backgrounds to help that specific demographic of people in that area, to to comfort some of your patients, if possible, because I think it goes a long way. That's something that could help.
Yeah. Yeah. It also affects them emotionally. Like you said, you felt the person kind of like, oh, okay, someone I can talk to is here, and someone I can trust is here because I can communicate with them.
Right. Yeah,
Yeah.
it provides that comfort, and it can change their whole experience. I would say lead by example, and just to stay present and consistent. Always stay consistent. Take the time to really listen to your staff. Maybe find out like what somebody's good at, and coach them up. Um, if you see that people are drowning, um, go out there and help them. Like, you don't have to stay in your office. Um, and try to remain positive and encouraging. Even if you're having a bad day, don't let the staff see that. And especially like minorities, we tend to get looked at under a microscope sometimes, or most of the time. So just kind of know that. So you always have to be on, like just do your best, but be
Yeah.
extra good and extra careful, because everybody's
Yeah.
watching.
Yeah.
I would say safety huddles, making sure everyone on the team is on the same page before you start your day, and relaying all that information. Make sure that information gets back to the surgeon and the anesthesiologist, like keeping everybody in the loop, the entire team, so everybody's on the same page. Also making sure like the patient is called, they have their instructions, the time of the surgery, the arrivals time match, the cases, just being very OCD and making sure everything is exactly how it needs to be.
Yeah. 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 Yeah.
I think sometimes we have issues with silos, like maybe the clinic, maybe. So, for example, the surgery center may think that the clinic is giving the patient a certain set of instructions, like stop this medication, don't eat past this time. And then the clinic thinks that the ASC is giving the patient this information. And then all of a sudden the patient has taken their blood thinner, or they've ate, too close to this time. So now the case is being canceled. So like if you have two different people giving two different sets of instructions, or nobody's given these instructions, then that's a problem. So I think coming together and like working together and collaboratively, that can help with some of the cancellations. Also, when it's too late and you do have a cancellation, that service recovery is really important. And then including the patient in the cancellation process, like making them feel like they're important and valued. Like, for example, this happened because of this, like being transparent with them.
Yeah. Mm-hmm.
And if you know that you're going to cancel that case, let them know right away.
Mm-hmm.
Because people have to think about daycare and
Oh yeah,
arrange, rides to work and take time off and all of that. So not just sit on it. I think the best way to increase revenue is word of mouth. Cost effectiveness, of course, lowering prices always attracts new patients. Negotiating with your vendors, like if we get 10 of these, can we get a group price for this, or can we up the par level here so we can save on this, and that kind of thing. But like one of our surgery centers is doing they did a study on using what was it, lavender oils to decrease like post-op nausea, vomiting, and the amount of medication that's given to patients after and during the procedures. And the comments that we got back on our patient satisfaction surveys were like, some of them said they felt like they were going to a spa. And it's like, okay,
that's nice.
Yeah, you had surgery, but like you're comparing it to a spa just because essential oil study. Sorry, I couldn't think of it.
Right.
Because of essential oils, and like to the surgery center, that's not really expensive. That's just that's nothing,
Yeah.
And if you can spend a little bit like that and then have it word of mouth, everybody's talking about it, that's huge. So that's a great way to increase revenue.
That's awesome. Well, thank you for joining us today, Lisette.
Thank you for having me.